Okay, let's explain some lab data. White cow, the normal range is 5,000 to 10,000. For pregnant women, it could be a little bit higher, like 10,000 to 15,000. Red blood cell, the normal range is 4 million to 5.5 million. For pregnant women, it could be a bit higher, like 5.5 million to 6.2 million. HB, the normal range is 12 to 18. For pregnant women, it could be a little bit lower because there's a lot more fluid inside of the blood body, so it can be diluted a little bit, so just more than 11 is enough. HCT is HB times 3, so it will be 36 to 54. But be careful. If someone got burned, both of those could be a bit higher. Burn patient, because when they got burned, especially after 48 hours, the burn patients, the blood inside the vessel will be transported to the tissue, so the blood volume will be lower and there's less blood inside of the vessel, so it will be more concentrated and the HB and HCT will be higher naturally. Platelets, normal range is 150,000 to 400,000. PT is 8 to 12 seconds. PTT, the normal range is 25 to 35 seconds. But if the patient is under heparin, then the normal range would be 45 to 70 seconds. INR, the normal range is 0.8 to 1.2. And if the patient is under warfarin, then the normal range will become 2 to 3. Sodium, the normal range is 135 to 145. So, if you see the sodium is like maybe 120, you will need to be very careful because it means the patient has cerebral edema. And it will make the patient has IICP. IICP, then the patient will have higher chance to have seizure. Once the patient is at a higher risk of having seizure, you need to have the seizure precaution. And once the patient has IICP, you can only do the brain CT to make sure. You cannot do the spinal tap, or it's also called lumbar puncture. Don't do lumbar puncture. Because it will make IICP even more serious. So it cannot. Don't do that. Just do brain CT, okay? And how about if it's a lot higher, like maybe 170? Then you need to give more like 0.45% of normal saline, or restricted sodium. Don't eat canned food. Don't. If it's 170, it means the sodium is way too high. Potassium. The normal range is 3.5 to 5.3. If the potassium is a lot higher, like it become like 6, it's too dangerous. You will have dysrhythmias. You need to take care of that as soon as possible. Usually, you need to give calcium gluconate. Okay. Calcium. The normal range is 9.0 to 10.5. Phosphate. The normal range is 3.0 to 4.5. Magnesium, 1.3 to 2.0. And if the calcium and magnesium is too low, if both of those are too low, then it might cause torsade point. It's also very serious. It's dysrhythmia. Okay. Chloride, 97 to 107. Ammonia, 15 to 45. Bilirubin, 0.2 to 1.2. GOT, 8 to 40. PaCO2, 35 to 45. And be careful. When a COPD patient is having the PaCO2 more than maybe like 70, the first thing is called a hypercapnia. You need to do BiPAP. It's also called MPPV. Yeah. So if you see a COPD patient, the CO2 is way too high, give BiPAP. It's also called MPPV. Okay. HCl sum 3, 22 to 26. 2 plus 2 plus 2 is 6, so it's easier to remember. PaO2, 80 to 100. SaO2, 95 to 100. Especially if you say there's a question, you need to choose something to prioritize. If you see the patient's PaCO2, SaO2 is like 92, 93, it's not a big problem actually. Don't choose the patient with 92 or 93 of SaO2 as the priority. Don't. It's not a priority. Even though the normal range should be at least 95, but still. Chest tube drainage, less than 100 cc per hour. BNP, less than 100. CKMB, less than 5. Myoglobin, less than 90. Troponin T, less than 0.1. How to remember that? I got a tip. You see, T and T. When you write it, you see, it's 100% the same. So it's 1. How about troponin I? How to remember that? T and I. T and I. It's only 50% the same. So it should be less than 0.5 because it's only 50% the same. And LDL less than 100. Triglyceride less than 150. Cholesterol less than 200. Cardiac output 4 to 8 liters per minute. CVP 2 to 6 mHg. MAP 70 to 105 mHg. PAWP 6 to 12 mHg. GFR more than 90. BUN 10 to 20. Creatinine 0.6 to 1.2. Urinary output more than 30 cc per hour. So if you see if a burn patient the urine output is less than 10 cc per hour, what would you do? You should increase the IV rate. It might be lactate or it might be normal saline, but you need to increase the IV rate because it's too little. SG 0.003 to 0.030. And I'll explain something. When it comes to dehydration and fluid overload, there are 2 types. One is called SIADH. It means too much ADH inside of the body. And one is DI, diabetes insipidus, and it's too less ADH inside of the body. And it will cause fluid overload. And DI will cause too much output. And if it's fluid overload, too much fluid inside of the body, so it will make urinary output very little. But because urine output is very little, so it will be concentrated, so SG will be high. But DI, because the urine output is too much, so the urine will be diluted, so SG will be low. Okay. Lithium, the normal range is 0.6 to 1.2. And lithium is for mania patients usually, bipolar. And you need to be very careful of the patient's sodium, especially if the patient is sweating a lot. It will cause the lithium inside the body spike up. So if he's sweating too much, lithium toxicity will be maybe higher. So be careful of the sweating because it will infect the sodium. Digoxin 0.5 to 2.0. It can perfect your heart rate and make it slower. So if the patient's heart rate is less than 60, stop. Phenytoin and theophylline, 10 to 20. Phenytoin is for seizure, usually chronic. You need to be careful if the patient has suicidal thoughts. And you also need to be careful if the patient, if he has new skin peeling or blistering. Why? Because it means Stevens-Johnson syndrome. Okay? And theophylline, you need to be careful of the patient if the patient is going to do the cardiac monitor to see if the patient has MI. You need to stop. If he is going to do this one, you need to stop theophylline, because theophylline will make your heart rate become faster. It will impact the result of cardiac monitor, and also it's also served as a kind of diuretic. Like caffeine is also very diuretic. Caffeine tea, because they have theophylline inside of it, so it will make you feel more jittered. Yeah.